Hello friends, if you haven't yet subscribed to the channel, it will be a good time to subscribe now. Hello friends, here is a reasoning question from the digestive tract. Let's see what the question is. A patient has undergone ileal resection. Now he suffers from steatorrhea. Explain why. I always say that for reasoning question, you need two abilities. One, ability to join the dots. You always know the facts in patches, but you need to join those dots, join the facts to reach to a correct answer. And the second ability is to understand the angle of that question. What is the angle behind that question? Let's understand these things. What is steatorrhea? Steatorrhea is excess fat loss into the stools, excess fat excretion into the feces. That is steatorrhea. Look, normally about 5 to 7 grams of fat are excreted normally daily in the stools. But if it increases, it becomes more than 20-30 grams per day loss of fats into the stools, then it is steatorrhea. And question is, after ileal resection, what is ileal resection? Surgically the ileum has been removed and therefore after that there is loss of fat into the stools. Explain why. Look at the angle behind this question. Fat digestion and absorption occurs in the small intestine. Fats are absorbed from the jejunum. Now, if the fats are completely absorbed from the jejunum, they are not reaching ileum. So, if ileum removal, it should not affect the fat digestion and absorption, but still it happens. That's the question. Why after ileal resection there will be incomplete absorption of fats and loss of fat into the stools? So let's understand this. Steatorrhea, excess fat loss into the stools, we already saw that, and due to the defective fat absorption. Now the crux of the matter is this: enterohepatic cycling of bile. Entero is intestine, hepatic is liver. So the bile acids, they are recycled in the body. Means liver secretes bile. In the bile there are bile acids. These bile acids reach the small intestine. They are involved in the fat digestion and absorption. So they will aid the fat digestion and absorption. After that, these bile acids are recycled. Means from the terminal ileum, they are reabsorbed with the help of a transporter called as sodium bile acid cotransporter. So bile acids are reabsorbed from terminal ileum. They again reach the liver, and from the liver they are again secreted into the bile. So this is recycling, enterohepatic recycling of the bile salts or bile acids. Now consider this: if the ileum has been surgically removed because of some disease process, ileum has been removed. It means now the bile acids cannot be reabsorbed. So enterohepatic cycling of bile, recycling of bile is disrupted, interrupted. And it means bile acids, once they come into the small intestine, they will be lost into the stools. Bile acids themselves will be lost into the stools. They cannot be taken back because there is no ileum. And loss of bile acids into the stools will cause what? It will cause depletion of the bile acid pool in the body. Gradually, the bile acid pool of the body will be depleted. And once it results in bile acid deficiency, then fat digestion and absorption also will be poor. It will be interrupted, disrupted. And therefore, fats now will be lost into the stools, resulting in steatorrhea. So this question demanded that you know the enterohepatic cycling of bile, and in the absence of this recycling, bile acids will be lost. There will be deficiency of bile acids, and therefore the fat digestion and absorption will be poor and fats will be lost into the stools. That was the reasoning question.